Hello, everybody. We're going to do an in-service on bowel movements today. I've been getting a lot of phone calls and there's some confusion. So you will find in your notebook a chart that looks like this. I know it's backwards because of the recording. Um, so we're going to use something called a Bristol stool chart, and basically it's real hard to tell what's normal and what's abnormal regarding stools that are passed. So we're going to use this chart that just helps to assess how long the stool has been inside the bowel, um, and what is normal for that person. So typically the stools should be the same. And a normal stool should be what is considered a type 3 or a type 4 on this chart that is in the Coral notebook. A stool should be passed once every 1 to 3 days. But again, it kind of depends on what's normal for the person. So as you're charting this, type 1 stool is separate, hard lumps. It's kind of like nuts, hard to pass. Type 2 is shaped like a sausage, but it's lumpy, which would be kind of like those hard nuts pressed in together. Type 3 is formed like a sausage, but it has cracks. It may look kind of dry, but that can be a normal bowel movement. Type 4 is smooth, a little on the softer side. It's shaped like a snake or a sausage. You may hear some nurses calling it a torpedo. That's a normal shaped bowel movement. Type 5 is soft blobs with clear-cut edges. They're passed easily. Type 6 is kind of fluffy, frothy looking with ragged edges or mushy stool. Type 7 is watery with no solid pieces at all. It's entirely watery. And as you can imagine, those would be considered diarrhea. Types 5 through 7 can indicate diarrhea. Types 3 and 4 are the easiest to pass. They're solid. Those are normal. Types 1 and 2 are hard, and those can indicate constipation. So if there's no bowel movement charted within 3 days, then you need to contact the office to find out what the bowel protocol is for your patient. On these, you will just indicate the type numbered in 1 through 7 from the Bristol chart. And if there's no BM, then you'll just mark an X. So make sure that you're filling out your bowel protocol sheets because you don't want there to be just an assumption that there's been no bowel movement and us go ahead with the bowel protocol and get people constipated. So anyway, that is the Bristol bowel charting. If you have any questions, please call the office at 423-428-9291. Thanks.